If you're suffering from hip pain, acupuncture can be really effective. I'm working on with some hip pain today, so I'm actually going to use some acupuncture on myself to show you how it works. So, in Chinese medicine, we believe that the body is interconnected. And the way that they imagined the body was a set of interconnected canals with water flowing through it. And we considered a dysfunction or pain in this case to be a blockage in that normal flow of water. So that gives you two ways to treat straight away. The first one is you can go to the site of the pain, and we'd call that local needling or arsho needling. Your physio might call it dry needling. Or, because we believe the body is interconnected and there's a blockage in one spot, that means there's a pooling somewhere else. The other way you can treat it is by needling where that water is pooled and then flushing through the system to relieve the pain that way. And that's what we call distal needling, or like, more traditional kind of ways. There's loads of different styles and techniques that you can use. I'm going to show you the one that I use today. So I'm using a 6-division pairing, which basically means I'm going to use my arm to treat my leg. So follow along. The first point I'm going to use, because the pain I've got is in the front of my hip. So it's my psoas, which is my hip flexor. So for us, it has a strong connection to the large intestine meridian. So I'm going to use 2 points from the large intestine meridian because that balances out the stomach meridian, or the hand yang ming to the leg yang ming. So the first point, and the most classic point that pretty much everyone knows, is large intestine 4 in Chinese medicine. So this is that one here. So it is a classic point, if you just watch, that is used to move obstructions throughout the entire body. So coming back to how I was talking about, we consider pain or dysfunction a blockage in that normal flow of water. This point here removes those obstructions, so therefore it deals and treats pain throughout the entire body. It has stronger associations for different parts. This has a very strong association to the hip, so I'm using it for that. The second point I'm going to use is also on the large intestine meridian, which is called large intestine 15. So it's right here. I'm just going to put it in. I might even get a little bit closer for you. Coming in like that. I'm going to insert at the top and then go down until I get a nice, what we call dirt chi sensation, which is essentially like a dull, heavy, weird, tingly sensation, or a twitch. In this style of acupuncture, that twitch gets you that instant change. So my hip is already starting to feel better. I can feel kind of warmth and blood flow through that area. Now the third point is a master tongue point. So it is in between a couple of meridians. So what it does for us is it kind of like gets more of the body that are in between those kind of main sections that it's been divided. It's still that same principle where I'm using one part of the body to clear an obstruction in the other to reduce pain. But it's just more of an interesting thing, and it can be very effective for basically for pain and hip pain particularly the type that I've got right now. And I'm just going to start that. So that one goes right in like that, in between the two fingers. And if you watch, I don't know if that's clear enough. I'll insert that nice and deeply. Sorry guys, it's a little bit hard to watch how I'm doing it through the camera. Into that area until I get a nice dull, heavy, weird. Wow, that got it. You might have even seen a little twitch there. So you can see that's quite deep. So those ones are in. They're stimulating the body to release essentially endogenous opioids, which is your body's natural pain relief, open up the blood flow, get you into what's called the parasympathetic nervous state, or rest and digest, so the body can start to heal. I prefer to think of it in the Chinese medicine way, which is we're trying to balance out how the body works. So if there's pain in one section or dysfunction in one section, we can use another part of the body to bring that back into harmony. And that gives you the ability to treat a whole bunch of extra stuff. So you can treat sleep, digestion, skin conditions, allergies, like balance out hormones, and a whole bunch of extra things on top of musculoskeletal conditions and pain. There is some really good Western medicine research, particularly on this point here, large intestine 4, it releases your body's own natural pain relief and also oxytocin. That's why it's used in natural labor induction and things like that. It has an anti-inflammatory reaction, which is also really cool. You'd think a foreign body being inserted into the like inserted into you, it should cause an inflammatory reaction. Your body should fight against it, but it actually does the opposite. And it has a whole bunch of other really cool things. If you have any questions, please comment below. But essentially, you can use one part of the body to treat another. It's really safe, simple and easy, particularly if you do have a sporting injury, if you're an athlete or you need to keep playing, because you can treat the site of pain away from it. So you're not risking further injury by the needle. It's really safe. And I'll take these out now because my hip is feeling better. Normally would have the needles in for 28.8 minutes at least, but this is enough for what I'm after today. Don't forget to like and subscribe.